Do you sometimes feel like you're twitchy, or that even the breeze on your skin feels painful? Maybe you've had a strange fear of water lately. Even thinking about drinking makes you tense. That might sound unusual, but it could be a sign of something serious called rabies. Rabies is a dangerous disease that attacks the brain and nerves. Once symptoms start, it's almost always deadly. But here's the good news, it's preventable. And the scary part, it often starts with a small bite, an innocent scratch from a stray dog or a bat flying too close. So, have you ever been bitten by an animal and didn't think much of it? Let's find out why that could be a big deal. What actually causes rabies? It's a virus, tiny, sneaky, and very dangerous. The rabies virus lives in the saliva of infected animals. So how do you get it? Mostly through bites. Imagine your dog spots a raccoon in your yard and they tussle. If that raccoon has rabies, the virus could jump into your dog through the bite. Now imagine you try to soothe your dog and it accidentally nips you. You could be at risk. The virus travels slowly from the wound into your nerves, heading toward your brain. Cats, bats, foxes, and even cows can carry rabies. Wild animals are the main culprits, but unvaccinated pets are a risk too. So ask yourself, is your pet up to date on shots? Early symptoms of rabies can be sneaky, like a fever, headache, or feeling tired. You might think it's just the flu. But soon, things get weird and scary. Do you flinch when someone turns on a bright light? People with rabies often get sensitive to light, sound, and even air movement. They may panic when they see water. This is called hydrophobia. Imagine trying to drink water, but your throat muscles spasm and lock up. Terrifying, right? Some people become hyperactive, confused, or even aggressive. Others go weak and paralyzed. Once these signs appear, the disease moves fast. And sadly, without treatment, it's almost always fatal. So, if an animal behaved strangely before biting you, like a dog barking nonstop or a bat flying during the day, would you take it seriously? Here's the hard truth. Once symptoms start, rabies is almost impossible to treat. Only a few people in history have survived, and they had very special care. But doctors can diagnose it. They test saliva, skin, blood, and sometimes spinal fluid. If you've been bitten by a strange animal, doctors act fast, without waiting for symptoms. They clean the wound deeply. Imagine pouring soap and water like you're cleaning a dirty cut, but for 15 minutes straight. Then they give you two things: rabies immune globulin, a quick-acting shield, and a series of rabies vaccines, which train your body to fight the virus. It's like sending backup soldiers and then training your whole army. But remember, waiting until you feel sick is too late. So, if you get bitten, would you rush to the hospital or wait to see what happens? Prevention is where we win the fight. Would you put on a seatbelt every time you drive? Think of vaccines as seatbelts for rabies. Pets like dogs and cats should get vaccinated regularly. It's simple, one shot, big protection. Avoid wild animals, especially if they seem confused, aggressive, or out during the day, like a raccoon in broad daylight. Teach kids not to touch stray animals, even cute ones. And if you work with animals, like vets or animal rescuers, you might need preventive vaccines. If bitten, wash the wound immediately with soap and water, then go to a doctor. Don't wait, your fast action could save your life. Ask yourself, is your dog vaccinated? Have you ever thought about what you'd do if a bat got into your room? Good news, science is fighting back. One exciting advance is a faster, cheaper way to make rabies vaccines using plant-based technology. Imagine growing vaccine ingredients in tobacco plants. Yes, really. Scientists are also testing new treatments like the Milwaukee Protocol, which helped one girl survive rabies without prior vaccination, though it doesn't work every time. Now, researchers are improving it. In rural areas, mobile labs are being tested to diagnose rabies quickly, where hospitals are far away. And some teams are working on single-dose vaccines to make protection easier worldwide. So, would you volunteer for a new vaccine that needs only one shot instead of 4? The future is getting brighter in the fight against rabies.